Shock is a life-threatening condition in which the circulatory system fails to deliver adequate oxygen and nutrients to tissues and organs, resulting in cellular dysfunction and potential organ failure. Shock is categorized into several types based on the underlying cause, and paramedics must quickly recognize and treat each type to prevent patient deterioration. Different types of shock: hypovolemic shock causes loss of blood, hemorrhagic or fluids, non-hemorrhagic, for example, from dehydration, burns, or vomiting. Signs: tachycardia, hypotension, cool, clammy skin, delayed capillary refill, and reduced urine output. Treatment: control bleeding, for example, applying pressure or using tourniquets. Administer IV fluids, for example, normal saline or lactated ringers to restore volume. Provide oxygen to improve tissue oxygenation. Rapid transport to a hospital for further interventions like blood transfusion. Cardiogenic shock causes: heart's inability to pump effectively, often due to myocardial infarction, heart failure, or arrhythmias. Signs: hypotension, chest pain, pulmonary edema, tachycardia or bradycardia, and jugular vein distension. Treatment: administer oxygen. Provide aspirin or nitroglycerin if myocardial infarction is suspected, per protocols. Consider medications like dopamine or norepinephrine for hypotension if permitted. Prepare for rapid transport to a facility with cardiac intervention capabilities. Distributive shock includes septic, anaphylactic, and neurogenic shock. Septic shock, caused by severe infection leading to systemic inflammation and vasodilation. Treatment: IV fluids, oxygen, and rapid transport for antibiotics and vasopressors. Anaphylactic shock, caused by severe allergic reaction leading to airway swelling and hypotension. Treatment: administer epinephrine, intramuscular, oxygen, antihistamines, and IV fluids. Monitor airway closely. Neurogenic shock, caused by spinal cord injury resulting in vasodilation and hypotension. Treatment: stabilize the spine, administer fluids, and provide vasopressors if necessary. Obstructive shock causes: mechanical obstruction of blood flow, such as intention pneumothorax, cardiac tamponade, or pulmonary embolism. Signs: hypotension, tachycardia, jugular vein distension, and signs specific to the cause. For example, absent lung sounds, intention pneumothorax. Treatment: for tension pneumothorax, needle decompression. For cardiac tamponade, rapid transport for pericardiocentesis. For pulmonary embolism, supportive care and oxygen with rapid transport. Mixed shock causes: combination of shock types, for example, septic shock causing hypovolemia and cardiogenic issues. Signs and treatment: depends on the combination but often involves fluid resuscitation, oxygen, and addressing the primary causes. Paramedic approach to shock assessment: perform a primary survey to identify life-threatening issues. Assess airway, breathing, circulation, and signs of shock. For example, altered mental status, hypotension, or tachycardia. Management: maintain an open airway and ensure adequate ventilation. Provide supplemental oxygen or assist ventilation as needed. Initiate IV access and begin fluid resuscitation, unless contraindicated, for example, in cardiogenic shock. Monitor vital signs and cardiac rhythm. Treat underlying causes promptly, for example, epinephrine for anaphylaxis, bleeding control for hypovolemic shock. Transport: paramedics should prioritize rapid transport to an appropriate facility while continuing treatment en route. Communicate findings and treatments to the receiving hospital for seamless care transition. Understanding the different types of shock and their treatment protocols ensures that paramedics can make life-saving interventions effectively.